This is Dr. Craig McInnes, and this is a continuation of our video blog series about veterinary cardiac ultrasound. Note the anatomy of the right side short axis left atrium aortic view. Note that in the right side short axis view, the M-mode cursor is actually crossing the aorta and left auricle rather than the greatest diameter of the left atrium. The aorta and left auricle at this point are usually close to the same diameter. The left atrium is usually larger than the left auricle. During left ventricular diastole, the aortic valve is in a closed position. The aortic diameter measurement is made at the end of the period of aortic closure when the aortic root is at its largest diameter. The aortic measurement can be compared to a chart of normal aortic diameters by body weight. During left ventricular systole, the aortic valve opens and blood is flowing through the valve. The left atrial diameter measurement is made at the middle of the aortic valve opening. At this point, the mitral valve, which is not shown, would be closed, and the left atrium is at its fullest diameter. The measurement of the left auricle, or left atrium, can be compared to a chart of normal left atrial measurements by body weight. The aortic diameter and left atrium are measured in this image. The ultrasound machine automatically calculates a ratio of left atrial to aortic diameters. Ratios exceeding 1.13 in dogs and 1.7 in cats suggest left atrial enlargement. Borderline measurements, like 1.14 for a dog or 1.8 for a cat, are probably normal. This image shows an extremely enlarged left atrium and pulmonary vein in a cat, suggesting volume overload and pulmonary hypertension. The LA-AO ratio is also extremely excessive. The calculation for the LA-AO ratio is based on an assumption that the aortic diameter is normal. If the aortic diameter is larger than normal, the expected meaning of the calculation may be incorrect. This 70-pound dog has severe aortic stenosis with a post-stenotic dilatation of the aorta. Normal maximum aortic diameter is 31 millimeters for this dog's body weight, but the patient's aorta measures 42.3 millimeters. The left atrial measurement is actually at the minimum normal diameter of 19.1 millimeters. The LA-AO ratio is misleading at 0.45 because the aorta is dilated. Remember, do not fixate on the measurements alone. Evaluate the two-dimensional images, M-mode images, and measurements as a whole.